But one thing about Arkansas is there are a lot of rural areas where there are not doctors' offices close by, but there may be a hometown pharmacy. And so, if you live in rural Arkansas and you think your child has strep throat and you don't want to drive 30 minutes to the closest town, but you can drive 5 minutes down the road to the pharmacy and get tested for it, then that's creating access that patients wouldn't have otherwise.
Yeah, but it's also there's a convenience factor, though. To me, even in town, I'm going to go in the clinic and I'm going to wait how long? I'm going to wait an hour.
And I may catch
something else. Let's not say that clinic. Let's say a clinic. I'm going to go in a clinic and I'm going to wait an hour or two as a walk-in, right? And then I'm going to go to the pharmacy, where I could just go to the pharmacy and in 5 minutes have a test.
Yeah.
And 10 minutes later walk out with Tamiflu. At some point, the market's got to say, hey, the clinic. Now maybe a clinic could have a triage. Wouldn't it be great if you walk in the clinic and they could say, hey, let's go ahead and swab you as a test. You don't need to see a doctor, right? We can test and treat and send you on your way.
Right. And there was a group of there was a couple of these ladies, they were in the CPSN booth at Amerisource. And that's what they do is they connect pharmacies with these virtual doctors or physician assistants that can go, cool, these are your symptoms. Let the pharmacy do the flu test. And then the physician assistant or doctor can go, cool, here's a prescription for that medication. And for your more rural, and also for the states that don't have quite the ability to prescribe Tamiflu or amoxicillin like Arkansas and I think didn't North Carolina just do something like that too? But it was for smoking cessation.
Yeah,
being able to prescribe and get that right.
But you have to think about some of these. There's decisions have to be made. A lot of times, clinics are designed around the efficiency of the doctor. They're not designed around the efficiency of the patient, right? If you have a 10 o'clock appointment, they tell you to be there at 9 and that kind of stuff. And so there's some of those low-end things that either clinics are going to have to become more caring more about the efficiency of the patient, or that's going to go to telehealth, or it's going to go to the pharmacy. And some of that stuff pays low enough that does the doctor really want to be doing it? So it'd be interesting to see where that goes. I get it, and we hear that a lot. We hear that a lot. One of the big things that is kind of going around the country and we talk about now is subscriptions, monthly. Pay for your pharmacy like you pay for your health club. Right. And something may be in there, maybe a telehealth benefit. So, you $50 a month comes with some kind of telehealth benefit. And, hey, this class of drugs is free if you get a prescription. You're really cheap drugs. And this next class is cost plus, et cetera. But there'll be a lot of people hesitant to that because, well, I got a doctor next door. But so many people don't have doctors. How many people today in the 30 and below don't have a primary care doctor? I didn't have they made us get a primary care doctor, just saying, in the last 2 years. I didn't have a primary care doctor before. I was Dr. Internet. I went and paid for my own labs once a year, and all my labs were great, and no reason for me to go sit and wait in a doctor's office.
Yep.